Good morning.
Good morning.
Sorry for the delay in getting started. We had a few little technical difficulties to sort out, but I think we've got them beaten down, so I think we're ready to start. Thanks a lot for coming. Obviously the weather's not encouraging for people to go out in it, so we appreciate you coming out. And I think that shows that you care about this issue, and that's a great thing. So, my name is Mark Arndt, as most of you know, and I'm the chapter leader for the Lehigh Valley chapter of Organizing for Action. Organizing for Action is a 501c4 issue advocacy organization. 501c4 issue advocacy organization, so we advocate issues. And that's what we're here to talk about today, a particular issue. And that particular issue is the Affordable Care Act. I want to thank Sacred Heart Hospital for allowing us to use their facilities, and a special thanks to Pete Schweer, who's sitting right over here. He's been instrumental in getting us the space and helping us get the technology set up, and Pete has a few housekeeping things that can help you know how to navigate this building.
Well, thank you, Mark. Again, for those of you who don't know, Peter Schweier, I serve as Director of Community and Government Affairs here at Sacred Heart Hospital, and I can barely turn on my iPhone. So the fact that we were able to actually make some of these facilities work here is actually pretty remarkable. But welcome all to Sacred Heart Hospital. Just a little background on the hospital. This is our 101st year of continuous service of healthcare to downtown Allentown. We were originally founded by a group of German nuns in this neighborhood in response to a diphtheria outbreak. So from our very beginning, Sacred Heart Hospital has always been here for one reason and one reason only, and that was to serve the specific and immediate healthcare needs of the people who live around us. A little bit about the hospital: 81% of our patients are either Medicare or Medicaid recipients, and another 6 to 7% are completely uninsured. So when you look at our overall healthcare, our overall patient mix, we are the safety net hospital for Lehigh County, the city of Allentown, and frankly for the Lehigh Valley. About 50% of our patients do actually come from the suburbs, but again, those patients aren't necessarily people that carry a ton of private insurance. So we are the safety net hospital. We are the closest emergency room to folks from a number of regions around here. We're proud to support any chance that we can. We will support people's opportunity to acquire affordable health care. On this floor, on the second floor, is our Affordable Care Act registration office, just down the hall across the street from our cafeteria. Around the corner from it, we have caseworkers that help folks who are eligible for Medicaid enroll in Medicaid. So we have a very robust system of helping folks who may not necessarily be the wealthiest or the most fortunate members of our community still have access to quality health care. We have a number of family practices. We're a full hospital. We have pediatrics, we have OBGYN, we have surgical services. So we are a full hospital, full community hospital that helps the people who need the help the most. And we're very proud of our role here in downtown Allentown and here in the Lehigh Valley. Just a little bit of housekeeping. Again, as you came in, if you parked in our parking deck, either 5th Street or Chew Street, you pulled out a little ticket. We have parking passes for all of you, unless anybody would like to make a donation to the hospital. I assure you will take it. We have parking passes, so as you leave, take that ticket along with one that we'll hand out today. Just give it to the attendant there, and that'll be fine. If anybody needs to use a restroom, and a special thank you to the person who helped my daughters go. It's around the corner and around the corner again. There's handicap accessible restrooms right around the corner. Aside from that, again, thank you all for joining us. Thank you for choosing Sacred Heart Hospital, and welcome.
Thank you. So, as Pete demonstrated very well, it's particularly appropriate that we be here today to talk about the Affordable Care Act. Sacred Heart provides a lot of uncompensated care to residents of this community, and the Affordable Care Act can help to fix that situation. And if we can get those folks insurance, then they can help to pay for the care that they get, and that would help Sacred Heart and lots of other hospitals in Sacred Heart's position. So, again, it makes a lot of sense for us to be here, and we're grateful that we're able to be here. All right. Recent news stories have reported that approximately 2 million folks have signed up for healthcare insurance through the exchanges, and the federal exchange and the state exchange by the end of December. And despite some problems in the beginning with the Federal Exchange, it appears that approximately 1.1 million people have signed up through the Federal Exchange through the end of December. Now, those are good numbers. That's a good start, but there's a long way to go. There are thousands of people in this state who are still eligible to sign up, thousands and thousands, and there are millions of people across the country who are still eligible to sign up. And as many of you know, enrollment can be completed by a number of different ways. People can go on the website and go to www.healthcare.gov. People can go and make a phone call, and the number for that is 1-800-318-2596. Paper applications can be obtained from the website. There are certified insurance brokers who will assist you in picking out your insurance, and we have one of those brokers here today who will be speaking later on. And for those who need help sorting through their options and understanding the coverage and what would be best for them and their families, there are trained individuals who can help them figure out what coverage works for them. And as Pete described, some of those individuals are here at Sacred Heart Hospital, and people come and make appointments, and I think there's the potential for either English or Spanish assistance. And there are other institutions in the Lehigh Valley who offer those services. So here in Allentown, there's the Allentown Health Bureau, and there's the Neighborhood Health Center on 2nd Street. So folks who live in this community have lots of resources that they can tap into to help them navigate these issues and make the right choices for them. So, why is it so important that people sign up for health insurance through Obamacare or the Affordable Care Act? Well, it's so important because it can change their lives. And that's what we're going to hear more about as we go through this morning's program. And I'm going to start with talking about some of the work that our group has done. We've been out canvassing the cities and neighborhoods of the Lehigh Valley. And as we go around the Lehigh Valley, we've been handing out information and encouraging people to apply for the insurance and to go online and to go meet with people and to pick out their insurance. And we've been all over the place. We've been in Easton Center Square, we've been on the south side of Easton, we've been in downtown Bethlehem, we've been on the south side of Bethlehem, we've been on the east side of Bethlehem, we've been in Allentown on Hamilton Street, we've been up and down 7th Street, we've been at 15th and Allen, we've been at 4th and Tillman. We're doing our best to reach out to the community and let them know what their opportunities are. And you know, that's what it's about, because when you talk to people, they're really excited. They're really excited about this opportunity that's being put in front of them. And, you know, I've had these encounters. I remember the woman who was in a wheelchair, and she was anxious to get information that she could share with her daughter. So I gave her my information, and she gave me her Jehovah's Witness pamphlet. And we both went on our way, but we had a nice little conversation together. And the young man who was at the counter in the corner grocery store, whose eyes lit up when he realized he had the potential to get insurance that he could actually afford, and he's never had that before. And the strapping 28-year-old African-American gentleman who was wearing a jacket that suggested to me he played college football, very athletic, and the kind of person who might say, oh, I don't need insurance, I'm going to be healthy. He recognized, he said, this is great, I need that insurance, because you never know what can happen. And the young man on the south side of Bethlehem, who doesn't have insurance, who used to have insurance, who broke his leg when he had insurance, and who now knows that he's vulnerable if something like that were to happen while he doesn't have insurance. So there are people out there in the community, and the shop owner, that's the other one I wanted to talk about, the shop owner who had 2 children in the shop with him and his wife, and it's obviously a small family business, who was very excited that now he was going to have the chance to purchase health insurance, and he could afford it for his family. So people out there can do in our communities and in the circle of friends and family and people that we know. And we as a group will continue to go out on the streets and try to get this information out to the community at large. So it's about making this opportunity available to people. And it's gratifying to see how excited they are about that possibility. So we're going to hear some more stories. I was talking about people who are first, learning and understanding what they might be able to obtain. We also have some people here who are going to tell some stories about actually getting that insurance, whether themselves or people that they helped get that insurance or people that they know. And so we're going to hear some of the good stories about how it's worked out for lots of people, and it's been such a positive thing for lots of people. So, and I think the themes that you're going to hear are, now I get better coverage than I ever did before. Now I'm paying a lower premium than I did before. I'm no longer being rejected for pre-existing conditions or having to pay a huge amount more because of pre-existing conditions. Those are the themes that are making it possible for lots of people to get insurance that never could before.